Hi, and welcome to part 4 of Principles of Immunization. My name is Doc Popo Solier, and in this part, we'll talk about vaccine safety, surveillance, and testing. For vaccine safety, these are some hazards of immunization. These can be reactions to inherent inoculation, faulty techniques, like giving the vaccines via the wrong route, hypersensitivity reactions, neurologic involvement, including encephalitis, paralysis, and even Guillain-Barré syndrome, provocative reactions, just like having hypotension after giving HPV vaccine, and others like giving live vaccines to women of childbearing age, and suddenly they become pregnant. Okay, and you gave it like within the 3 months before the pregnancy. No immune response is entirely free from the risk of adverse reactions or remote sequelae. So, just more on the neurologic involvement. There can be neurotic manifestations, but very rare. Encephalitis and encephalopathy were recorded to in some patients following administration of anti-rabies and smallpox, and Guillain-Barré syndrome in association with swine influenza, as well as measles. Just to review, Guillain-Barré syndrome is an autoimmune disease that attacks your myelin sheath, causing weakness, and this progresses over hours to days. They can have minimal muscle atrophy, and usually they begin in the lower extremities and ascends bilaterally, causing weakness, ataxia, and bilateral paresthesia, progressing to paralysis. How safe are vaccines? So it's very important to know about vaccine safety. Ongoing safety monitoring are needed. Programs are needed for the development of sound policies and recommendations. Okay? Because the general public has low tolerance to adverse effects. Okay? And this is not only true for vaccines, but in for medications in general. If they experience adverse effects, they will tell other people about their adverse effects, discouraging other people from getting vaccinated or getting medications. Diba? As vaccines are usually given to healthy persons. So when they get symptoms and you didn't explain them properly, then they might not want to go back to you. Expectation to safety standard is higher with vaccines compared to medicines for sick people, since they expect that they will not get sick. So you have to explain that they will still experience some form of malaise or soreness of the area of injection. National regulatory authorities rigorously ensure the quality, safety, and effectiveness of vaccines and pharmaceutical products once they are introduced. Okay, but continuous monitoring happens. This is just a comparison of annual morbidity from vaccine preventable diseases during the 20th century. As you can see, diphtheria, we have a 100% reduction. Polio, 100% reduction. Congenital rubella syndrome, also 100% reduction. This is from CDC. This is 2010. I think some of them re-emerged. Smallpox, look, zero. Okay, and a few more which have a lot of reduction, diba? Mga 90 plus percent. Okay, so vaccines are effective. This is what this table is all about. Telling you that vaccines are really, effective. There are many phases of the vaccine trials. So pre-licensure vaccine safety studies are done in the laboratory and done to animals. Then afterwards, pre-licensure human studies occur. So these are your phases 1, 2, and 3 trials. So right now, COVID vaccines are being investigated and some of them are already at phase 3. The target is to identify common reactions that may occur after vaccination. The pre-licensure vaccine safety studies, ito, usually look at effectivity. And pre-licensure human studies also look at, especially the first few ones, also look at effectivity. Vaccines are tested in thousands of persons before being licensed and marketed. Post-licensure surveillance is phase 4. You identify the rare reactions, so you're already selling. You already have the license. Okay? but you still monitor. Identify risk factors for reactions and identify vaccine lots with unusual rates of types of events. Kasi may lot number yan, which you have to take note, by the way, because they have batches. And when you recall a batch, you have to take note, okay? Identify signals. Post-licensure vaccine safety activities, we have phase 4 trials, large link databases, and clinical immunization safety assessment network. And here in the Philippines, we are supposed to report vaccine-related reactions. So just a review of your clinical trials. Trial phase 1 test the safety and immunogenicity of a vaccine. Usually sample size is 10 to 100. Phase 2 is about monitoring safety, potential side effects, immune response, and determine optimum dosage. Tinadagdag and schedule. That's for 100 to 1,000 people. Phase 3, mga 1,000 to 10,000 people, address clinical efficacy in disease prevention and provide further safety information from more heterogeneous populations. So you're looking at how the different population groups would react to the same vaccine. And then submission for approval. And then you have the phase 4 trial. These are vaccine adverse reactions. An adverse reaction is an extraneous effect caused by the vaccine. Side effect, usually with pain, swelling, or worse, or like a hematoma. Adverse event is any event following vaccination and does not necessarily mean that it's because of the reaction or the vaccine. Okay? So it can include adverse reactions or coincidental reactions. Okay? Maybe a true adverse reaction or it can be coincidental. So these are called adverse events following immunization or AFEs. And these are some of the vaccine adverse reactions. So again, if it's a vaccine adverse reaction, it's always related to the vaccine. These can be local at the injection site, usually mild and self-limited, or systemic. They can have fever, malaise, headache, non-specific but maybe unrelated to the vaccine, or allergic due to the vaccine or the vaccine component. Frequency and severity of adverse vaccine reactions, very common, would be fever, malaise, okay? And very rare are the ones that occur in less than 0.1% of the population, like osteitis and BCG, severe allergic reaction like anaphylaxis, okay? This table shows you the potential stages in the evolution of an immunization program, and this is kind of related to adverse events. Okay, so you have a disease that's pre-vaccine. The incidence of the disease is very high. However, as you increase vaccine coverage, as you can see in the green dotted lines, represented by the green dotted lines, okay, the disease incidence goes down. However, if the adverse effects or events, not necessarily reactions, reach a certain amount, okay, what can happen? There will be loss of confidence. That's stage 3. So people will start doubting your vaccine. We don't like your vaccine because it's causing this, causing that. Especially if you didn't explain properly. Or if it's a new vaccine, you still don't know the adverse effects, diba? So, what will happen if you decrease vaccine coverage? You will have an outbreak. That's why there were measles outbreaks, diba? So, because of the outbreak, people will start to say, oo nga pala, because we're not taking vaccines anymore. That's why there's a... Okay, and then people will go back to being vaccinated. Resumption of confidence. Until you eradicate the disease. Alright, so that is always the target, eradication. So these are vaccine adverse events. Vaccine Adverse Event Reporting System or VAERS. It's a national reporting system. In the US, it's jointly administered by the CDC and the FDA. Here in the Philippines, it's the FDA. Passive depends on healthcare providers and others to report. So it's not active. They're not actively seeking for adverse effects. They don't go to door. O meron ba kayong adverse events? Not like that. It's passive. So it relies on the cooperation of the doctors. That's the same way it's done here in the Philippines. Detects the following new or rare events, increases in rates of known side effects, and patient risk factors. Not all adverse events are caused by the vaccines. Remember that. Okay, this is just an example of a case investigation formed by the DOH and the FDA and the PISMID. Philippine Infectious Disease Society, I think. So if you're a doctor already, you have to know what forms to answer. Okay? There's a case investigation form which you have to submit to FDA. To FDA. This is another case report form. Okay, this is just an example. Please do not memorize. There are types of APHIS here. So you have to place the type here in the type of APHI. That's why you're studying this. These are examples of reportable serious APHIS. Anaphylactoid reaction, anaphylaxis, okay? Persistent inconsolable screaming. So merong neurotic symptoms. TSS and others. Syempre death. So there's also an onset time interval. So these are the classifications of APHIS. Vaccine product related reaction. It means that it's related to the product. Okay, example would be extensive limb swelling following DTP vaccination. Next is vaccine quality defect related reaction. It means that there's a failure of the manufacturer to completely inactivate polio, let's say. That's why some cases of polio happened before. Immunization error related reactions. Wrong route, wrong dose, inappropriate vaccine handling. Let's say you took it out from the cold chain. Immunization anxiety related reaction. So vagal syncope. Like they're so scared or so scared of needles. They get panic attacks or they faint. Coincidental, caused by something other than the vaccine product, error, or anxiety. Fever caused by an actual infection. Okay? But, coincidentally, it coincided with the vaccination time. Okay, so that's coincidental. Ways to minimize adverse events. Train immunization workers. So I do this also for my other work in the company where we do immunization programs for corporations. We train nurses and update them. Proper storage. Avoid mixing vaccines with other drugs and food. Use sterile single-use syringes and reconstitute the vaccine only with a specific diluent. Again, I showed you a table in part 1. Usually, it's just plain NSS, normal saline solution, or sterile water. But you have to look at the manufacturer's label or instructions. Discard reconstituted vaccines within 6 hours or at the end, whichever comes sooner. Or it depends on the manufacturer's product. Carefully conduct epidemiologic investigation of an APHI to pinpoint cause. And monitor vaccinees for 15 to 20 minutes after vaccination. So don't let them go home yet. You have to monitor them. That's a must. Contraindications and precautions. What are the differences between the two? Contraindication is a condition in a recipient that greatly increases the chance of a serious adverse reaction. Precaution might increase the chance of or severity of an adverse reaction or might compromise the ability of the vaccine to produce immunity. Permanent contraindications are the following. Severe allergic reactions to a vaccine component. Severe. So if it's a mild allergy, precaution lang. Encephalopathy, not due to identifiable causes occurring within 7 days of pertussis vaccination. Severe combined immunodeficiency. This is for rotavirus vaccine. And history of intussusception for rotavirus vaccine. Those are two contraindications for rotavirus. Contraindications and precautions. Allergy to components, contraindicated, whether it's inactivated or live. Encephalopathy, contraindicated for inactivated ones if they experience na encephalopathy already. Pregnancy, okay? For pregnant women, vaccinate except for HPV if indicated. Like for example, Tdap. Contraindicated yung live, we talked about that. Immunosuppression, the same. Severe illness, precaution. Okay? Recent blood products, inactivated, do not give. Precaution for, vaccinate. Because, diba, the antibodies do not really interact with inactivated viruses. But for live, precaution. And you have to wait for a certain amount of time. Invalid contraindications to vaccination. So some people don't get vaccinated because of these reasons. If they get fever, I have fever. But right now we have to consider that the COVID situation. So if you have fever, you have to stay at home and not go to a clinic. You might infect the doctor, okay? Antimicrobial therapy. So if you're taking drugs like antibiotics, okay, that's not a contraindication. Disease exposure or convalescence, pregnant or immunocompromised persons in the households, and breastfeeding. Preterm birth. So they're allowed to be vaccinated. Allergy to products not present in the vaccine. So if you just have allergy to crabs, let's say, okay, that's not a contraindication. Family history or of adverse events, tuberculosis skin testing, multiple vaccines, and mild moderate local reaction or fever following a prior dose. So what questions will you ask a patient about to be vaccinated? So a patient seeks for consult for vaccine. These are the important questions to ask. Are you sick today? Do you have an allergy to any medication, food, or any vaccine before? Or you describe the allergic reaction? Ask them to describe it. Has the child had a serious reaction to a vaccine in the past? Okay, this is not only for a child, for adults also. Has the patient had a seizure, brain, or nerve problem? Does the patient have cancer, leukemia, AIDS, or any other immune system problem? Has the patient taken corticosteroids or any other drugs like anti-cancer meds? Has the child or patient received a transfusion of blood or blood products? So ask that also. Is the child or teen pregnant? Or is there a chance she could be pregnant during the next month? Has the child received vaccinations in the past 4 weeks? This is specifically for live vaccines because you'd want to wait at least 4 weeks, diba? Vaccinations during acute illness. No evidence that acute illness reduces vaccine efficacy, so you can give. Vaccines should be delayed until the illness has improved to avoid transmission of the disease. Mild illnesses are not contraindications, alright? So what's the provider's role? You help to ensure the safety and efficacy of vaccines through proper management of vaccine side effects. Reporting is very important and it's commonly missed. Vaccine benefit and risk communication. So you also have to tell the patients what types of reactions can occur so that they expect. Opportunities for questions should be provided before each vaccination. Alright? Vaccine information statements. There are statements or there are papers or brochures which you can give right prior to the vaccination. That's what I do. So that they get educated and then I just let them ask questions during the vaccination process. Vaccine surveillance and testing. This is just short. This is for monitoring vaccine effectiveness through different types of studies. For randomized control trials, this is good for new vaccines. Basically, this is an experiment. So you have two groups, one with the vaccine, one with a placebo. So you compare the two and you get the attack rate for both. Attack rate is the number of persons ill over the number of persons exposed to the disease. So to compare, AR for the unvaccinated minus AR for the vaccinated over AR for the unvaccinated times 100. That gives you the vaccine effectiveness. No need to memorize the just know the indication for these types of studies. Retrospective cohort studies are good for evaluating protective efficacy of the vaccines. Okay? Case control studies are done because RCTs are costly. So it's an alternative. So you can still compute for the vaccine effectiveness. But again, RCTs are better. And incidence density measures are used to determine optimal timing for administration of a new vaccine and the duration of the immunity produced. All right. So these are just some general considerations. Storage, but some should be frozen, like the sole measles vaccine and polio. Observe recommended frequency. Informed consent forms. Okay. So ask them to answer that first. Document and include the lot number, date of the manufacturer or expiry, and mark the charts for those who missed doses. Thank you very much, and these are my sources. I hope you learned a lot from the lecture series. And these things, I know they are very overwhelming, but they are very, very useful in practice. I've been using them like monthly, not naman monthly vaccination programs, but people would ask, especially during the time of the pandemic. Okay? So some considerations during the pandemic for pediatric patients with recommended vaccines. It's they should prioritize the primary series first, and then the other ones which are nice to have can be given after the pandemic. And when they are brought to the clinic, companions should be at least 1 to 2. Okay? At least one na lang sana. At most two pala, sorry. And then, of course, safety issues like face mask, face shield should be worn. Okay? So, basically, as a doctor, you still have to evaluate the pros and cons of vaccinating the child during this pandemic. Okay? But a priority would be to give the primary series. And if there are cases of like outbreaks in specific areas, then you have to evaluate the patient and give appropriate vaccines accordingly. All right. So thank you very much for listening, and I hope you enjoyed listening and you enjoy learning the vaccines.